Have you ever felt something off in your body, an unusual fatigue, a strange ache, or a tightness you just couldn't explain, and told yourself, it's probably nothing? That quiet voice of concern, the one you brushed aside, might have been your body's way of sounding the alarm. As we grow older, it's easy to chalk up every change to aging. A little more tired than usual? Must be getting old. A bit of weight loss? Maybe it's the diet. But doctors warn that some symptoms, even the ones that seem mild at first, can signal something far more serious. And if you're over 65, your margin for ignoring these warning signs gets smaller by the day. The truth is, your body often whispers before it screams. And if you learn how to listen to those whispers, you might just save your life. In this video, we're going to walk through 6 symptoms that doctors say you should never ignore, because they may mean something inside your body is breaking down fast. These are not just medical facts. They are real-life red flags that could help you catch serious illness before it's too late. So if you're watching this, stay with me until the end. It could be one of the most important conversations you have about your health. Because after 65, being informed isn't just helpful, it's essential. 1. Unexplained extreme fatigue. When tired isn't just tired. Everyone feels tired now and then, especially after a long day or a restless night. But there's a kind of exhaustion that goes far beyond needing a nap or a cup of coffee. If you're feeling constantly drained, even after a full night's rest, and everyday tasks suddenly feel like climbing a mountain, your body may be telling you something far more serious. Doctors often see this kind of fatigue in patients whose organs are under stress, especially the heart, kidneys, or immune system. It's not just the normal slowing down of age. It's a warning signal. Imagine this. You used to enjoy your morning walks around the block, but now you can barely make it to the mailbox without feeling winded. Cooking a simple meal feels like a chore. Even holding a conversation leaves you worn out. This isn't laziness. This isn't just getting older. This is your body conserving energy, because something inside is struggling to keep up. In older adults, extreme fatigue can be an early symptom of heart disease, advanced cancer, or kidney failure. Sometimes it appears gradually. Other times, it comes on suddenly without warning. And when it interferes with your ability to enjoy the things you used to love, reading, gardening, visiting family, that's when it becomes a serious red flag. So what should you do? Start by paying attention to the pattern. When did it begin? Is it getting worse? Does rest make any difference? If you've been feeling unusually weak or depleted for more than a few days, don't wait. Schedule a visit with your doctor. Ask for a full checkup, including blood work, heart health, and energy-related labs. Remember, energy is life. When it starts to disappear without reason, it's not something to push through. It's something to investigate. Catching the cause early could make all the difference in protecting your health and independence. 2. Sudden and severe chest pain or pressure. Don't wait to call for help. There's one symptom that doctors never take lightly: sudden, severe chest pain, especially if it feels like pressure, squeezing, or something heavy sitting on your chest. If this pain comes out of nowhere and spreads to your arm, neck, jaw, or back, you may be seconds away from a life-threatening emergency. Many older adults mistake this kind of pain for heartburn or muscle strain. But here's the hard truth. This type of discomfort could signal a heart attack or a dangerous aortic dissection. And when it comes to heart-related emergencies, every second matters. Chest pain caused by a heart attack doesn't always feel dramatic. It may start as mild discomfort or tightness and gradually worsen. You might also notice shortness of breath, cold sweats, dizziness, or nausea. These are red flags, especially for people over 65 who are at higher risk for cardiovascular issues. Even more alarming is the possibility of an aortic dissection, the tearing of the body's main artery. This often causes sharp, ripping pain in the chest or upper back and can lead to fatal internal bleeding within minutes. It's rare, but when it happens, the window to act is incredibly small. If you experience any of these sensations, do not lie down and wait. Do not assume it's stress or indigestion. Call 911 immediately. Emergency responders can assess your condition and begin treatment en route to the hospital, giving you a much better chance of survival. Remember, the most dangerous mistake isn't overreacting, it's waiting too long. It's far better to go to the emergency room and find out it's nothing than to ignore the signs and face tragedy. At this stage in life, your health can shift quickly. Trust your instincts, listen to your body, and never hesitate to get help when your chest sends out a warning. 3. Difficulty breathing or shortness of breath. When air feels out of reach, breathing is something we often take for granted until suddenly it feels like we can't get enough air. If you find yourself gasping for breath while sitting still, or if climbing a few stairs leaves you struggling to inhale, that's not just aging. It could be your body's urgent cry for help. Doctors warn that unexplained shortness of breath is a serious symptom, especially in people over 65. It may be caused by heart failure, a blood clot in the lungs, pulmonary embolism, or even a silent heart attack. These are not minor issues. They're medical emergencies hiding in plain sight. One of the most dangerous culprits is a pulmonary embolism, a blood clot that blocks blood flow to the lungs. It can come on suddenly and often starts with just mild chest discomfort or breathlessness. But within moments, it can feel like you're suffocating. Another common cause in older adults is congestive heart failure, when the heart can't pump blood effectively. This leads to fluid buildup in the lungs, making it harder to breathe, especially when lying down. Some people even wake up in the middle of the night gasping for air. And don't overlook the possibility of a silent heart attack. While many expect chest pain, some heart attacks only show up as extreme fatigue, nausea, and, you guessed it, shortness of breath. That's why so many people ignore the signs until it's too late. So what should you do? If you're having trouble catching your breath, and especially if it comes on suddenly or worsens quickly, sit down, stay calm, and call 911. Don't try to walk it off or wait for it to pass. When breathing becomes a struggle, your body is sending a clear message. Something isn't right. And the sooner you act, the better your chances of recovery and of getting back to living the life you love. 4. Drastic and unexplained weight loss. When losing pounds becomes a warning sign. At first, it might seem like a blessing. You notice your clothes are looser, the number on the scale is dropping, and you haven't changed your diet or exercise habits. But when you're over 65, sudden and unexplained weight loss isn't something to celebrate. It's a serious red flag. Doctors warn that losing more than 5% of your body weight in less than 6 months without trying can signal that something is wrong deep inside your body. This kind of weight loss may point to conditions like cancer, heart failure, thyroid disorders, or digestive diseases. Certain cancers, such as those of the pancreas, lungs, or gastrointestinal system, often cause weight loss as one of the first symptoms. These cancers alter how your body processes nutrients and burn energy even when you're at rest. So while the scale might show progress, it could be masking something far more dangerous. Other conditions like diabetes, hyperthyroidism, or chronic infections, such as tuberculosis or advanced urinary tract infections, can also lead to rapid weight loss. And in many cases, malabsorption, when your digestive system stops absorbing nutrients properly, can cause the body to burn through both fat and muscle. Older adults are particularly vulnerable because we naturally lose muscle mass with age. When this is accelerated by illness, the result can be frailty, fatigue, and a higher risk of falls or injury. If you've noticed your belt needing more notches, or if loved ones comment that you look thinner, it's worth investigating. So what should you do? If you've lost 10 pounds or more without trying, or if your clothes are fitting differently and you're feeling more tired than usual, don't brush it off. Schedule a full physical, including blood tests, imaging, and a nutritional evaluation. Unexplained weight loss isn't just a cosmetic change. It's often your body's way of signaling that it's under attack. And the earlier you catch the cause, the better your chances of treating it effectively and maintaining your strength and independence. 5. Confusion, disorientation, or sudden personality changes. When the mind sends a distress signal, it's unsettling to suddenly forget where you are, lose track of time, or struggle to find the right words in a familiar conversation. When moments like these happen out of the blue or start becoming more frequent, it's not something to ignore. For older adults, sudden confusion or changes in personality can be a warning sign of something far more serious than simple forgetfulness. Doctors stress that mental changes that come on quickly, within hours or days, may point to a stroke, severe infection, or even the early stages of neurological disease. Unlike the slow decline we might associate with aging or dementia, these shifts often appear suddenly and can be dangerous if left untreated. A mini-stroke, also called a transient ischemic attack, TIA, can cause brief moments of disorientation, trouble speaking, or memory gaps. These episodes might only last a few minutes, but they're often precursors to a larger, more damaging stroke. Another hidden cause? Infections, especially in older adults, can impact the brain without obvious signs like fever. Urinary tract infections, for instance, can lead to confusion, agitation, or even hallucinations in seniors, particularly if left untreated. Similarly, sepsis, a life-threatening response to infection, may start with mental fog before physical symptoms set in. And then there's the concern of sudden onset dementia or fast-progressing neurological conditions. While most forms of dementia develop gradually, a sudden and severe drop in mental clarity should always prompt immediate evaluation. So what should you watch for? If you or someone you love begins acting differently, forgetting things frequently, becoming unusually irritable or withdrawn, or struggling to follow simple conversations, don't write it off as just aging. These could be signs that the brain is under stress, or that something else in the body is affecting cognitive function. Act quickly. Seek medical attention, request cognitive testing, and investigate potential causes. Because when it comes to brain health, every hour counts, and early action can make all the difference in preventing permanent damage. 6. Severe and persistent abdominal pain. When it's more than just a stomachache. A little indigestion or occasional bloating is something most people experience from time to time. But if you're feeling deep, sharp, or constant pain in your abdomen, especially if it's getting worse or lasting for hours, it may be something far more serious than a passing upset stomach. For older adults, doctors warn that persistent abdominal pain can be a sign of a life-threatening condition. One of the most urgent concerns is a ruptured abdominal aortic aneurysm. This happens when the main artery running through your abdomen, the aorta, develops a weak spot that suddenly bursts. The result is internal bleeding that can be fatal in minutes. The pain is often described as sharp, tearing, or pulsing in the belly, lower back, or side. Another dangerous cause is intestinal ischemia, where blood flow to the intestines is suddenly cut off, often by a clot. This leads to tissue death, infection, and severe abdominal pain that doesn't go away. You might also experience bloating, nausea, or the inability to pass stool or gas. Conditions like pancreatitis, inflammation of the pancreas, and gallbladder attacks can also cause intense abdominal pain that radiates to the back or worsens after eating. These are more common in older adults and can quickly progress to dangerous infections or organ damage if ignored. The key red flags to watch for include pain that lasts more than a few hours, pain accompanied by vomiting, fever, or dizziness, a swollen or tender belly, changes in bowel habits, or dark stools. So what should you do? If you're experiencing this kind of pain, do not try to tough it out or assume it'll pass. Call 911 or go to the emergency room immediately, especially if the pain is severe or you feel faint or short of breath. At this age, ignoring abdominal pain could mean missing the early signs of something deadly. Taking action quickly could be the difference between a full recovery and a critical emergency. By the time we reach our golden years, we've learned to live with a few aches and changes. But some symptoms aren't just part of getting older. They're serious warning signs that your body is in distress. And when you're over 65, paying attention to these signs isn't just smart. It could save your life. We've talked about 6 symptoms that doctors never ignore: unexplained extreme fatigue, sudden chest pain, shortness of breath, rapid weight loss, sudden confusion, and persistent abdominal pain. These aren't everyday discomforts. They're red flags, your body's way of saying, something is wrong, don't ignore me. The challenge is, many of these signs can appear quietly or feel like things you can push through. But waiting can lead to delays in diagnosis, missed treatment opportunities, or even life-threatening emergencies. Here's the good news. You have the power to act. You know your body better than anyone else. If something feels off, trust that instinct. Speak up. Make that doctor's appointment. Ask for tests. Call 911 if it's urgent. You don't need to live in fear, but you do need to stay aware. Your health is your foundation for your independence, your joy, and your time with loved ones. Staying informed is one of the most important ways you can protect it. So take what you've learned today and carry it with you. Share it with someone you care about, because knowledge isn't just power, it's protection. Thank you for being here and for taking your health seriously. We're here to support you every step of the way.